Mr. Chairman, on the vote of those present, the yeas are 8, the nays are 5. On the vote by proxy, and for the record only, the yeas are 0, the nays are 2. On this vote, the yeas are 8, the nays are 5, and the motion is agreed to.
So Dr. Anthony Fauci is 85 years old. He served this country under 7 presidents, Republican and Democrat. He spent decades fighting HIV/AIDS, Ebola, Zika, influenza, and finally COVID-19. And this week, a Senate committee voted to hold him in contempt of Congress. Not because he refused to show up, because he showed up. Not because he ignored a subpoena. He was there. He sat in that chair. He invoked a constitutional right, the Fifth Amendment, after the chairman of that committee, Senator Rand Paul, has spent years publicly calling for his prosecution. I'm Dr. Ida Brown.
And I'm Dr. Sonia Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. So the Senate Homeland Security and Governmental Affairs Committee voted along party lines to hold Dr. Anthony Fauci in contempt. And Chairman Rand Paul referred the matter straight to the Department of Justice, bypassing a full Senate vote. Let's run this clip.
Seeing no other motions, the question is on reporting of an original resolution regarding contempt of Congress. The clerk will call the roll.
Senator Johnson.
Yes.
Senator Langford.
Aye.
Senator Scott.
Yes.
Senator Hawley.
Aye.
Senator Moreno.
On behalf of the millions of people harmed by Anthony Fauci, resoundingly yes.
Senator Ernst. Aye. Senator Moody. Aye. Senator Peters.
No.
Senator Hassan.
No.
Senator Blumenthal.
No.
Senator Fetterman.
No.
Senator Kim.
No.
Senator Gallego.
No by proxy.
Senator Slotkin.
No by proxy.
Senator Paul.
Yes.
And again, this committee voted 8-7, 2 of which were by proxy, along party lines to hold Dr. Anthony Fauci in contempt and send the referral directly to the DOJ. Senator Paul moved without a vote of the full Senate, a step Democrats and legal experts are very much questioning right now. And America, I need you to understand what this really is about, because it's no longer about Dr. Anthony Fauci anymore. It's the messaging that we send to the next scientist asked to stand at the microphone during the next pandemic and tell the country something it doesn't want to hear.
You know, with all seriousness, this should concern every physician, every scientist, nurse, and even public health worker. And frankly, every American should expect someone competent with integrity to answer the phone when, not if, the next outbreak comes. Because almost the same week Congress escalated its political shenanigans with one of America's most recognizable infectious disease scientists, America finally got a new CDC director. Let's run that clip.
In the day's other headlines, the Senate confirmed Dr. Erica Schwarz as the new director of the Centers for Disease Control and Prevention today.
On this vote, the yeas are 51, the nays are 44. The nomination is confirmed.
The former Deputy Surgeon General takes over at a delicate time for the agency as it grapples with political interference and low morale.
A delicate time. Well, for the first time in the history of the agency, she's a Black woman. So Dr. Erica Schwarz was confirmed by the Senate on Wednesday, 51-44, and the CDC's first permanent director in nearly a year after an extraordinary stretch of turnover and instability. So look at the picture Washington just painted for us. On one side, you have Congress threatening a legendary infectious disease physician with prosecution. And then on the other side, a physician is walking into the most politically dangerous public health job in America. And with the deck already stacked against her, we say, welcome to the CDC, Dr. Schwarz. No pressure. So let's be clear about what happened. In July, Dr. Fauci appeared under the subpoena before the Senate Homeland Security and Governmental Affairs Committee. And as part of that investigation into the government's COVID response and the origins of SARS CoV-2, he invoked the Fifth Amendment more than 100 times. His reasoning, of course, was Senator Paul had spent years accusing him of crimes of publicly demanding him to be prosecuted and imprisoned. So Fauci's attorneys advised that answering under these conditions could expose him legally, what they called a perjury trap. So Fauci has consistently denied lying to Congress about the NIH-supported research in Wuhan and maintains his prior testimony was truthful.
So let's talk legality at the center of this hearing, right? Before leaving office, President Biden gave Fauci a preemptive pardon, and that was covering federal offenses through January 2025. Senator Rand Paul argues that pardon removes Fauci's federal jeopardy, so he can't plead the fifth. Fauci's lawyers counter that he can still face state or local prosecution, which preserves that right. So this is a genuine, fact-specific legal dispute, and it belongs in the courtroom, not in a press release.
Yeah. And for us to be fair to the oversight side, right? Congress has every right to investigate what happened during COVID. We're not questioning that. We should investigate the response, any of the mistakes, the origins, the funding, the preparedness. Science does not get an immunity from scrutiny.
Right, but scrutiny and punishment are not the same thing. The Fifth Amendment is not an admission of guilt. It's a constitutional protection. Its invocation is not proof of wrongdoing. And it also does not prevent Congress from pursuing legal and lawful oversight. And when oversight opens with a politician announcing that someone belongs in prison before a single question is asked, we should at least wonder whether we're still looking for answers or are we looking for a defendant? And that distinction really matters because there will be another pandemic, another novel pathogen, and the next scientist at that microphone will remember exactly what happened to Dr. Anthony Fauci. So the bigger problem is right here is what doctors are understanding immediately. Medicine depends on people willing to deliver bad news. Sometimes that biopsy is malignant. Sometimes the culture is positive. Sometimes the infection is spreading. And sometimes the evidence changes. And sometimes the correct medical recommendation is politically inconvenient.
Yeah, you cannot build a public health system where scientists quietly conclude, so if my evidence embarrasses the government, I could become the investigation, right? Because that's what we're all thinking now. Because eventually people stop telling leaders what they need to hear and start telling them what they want to hear. And that's not public health, you guys. That's public relations. And viruses are notoriously unimpressed about polling numbers. So, which brings us to Dr. Erica Schwarz. She's not inheriting a normal CDC, right? She's a physician, she's an attorney, a retired Navy Rear Admiral, a former Deputy Surgeon General, and a former Chief Medical Officer of the U.S. Coast Guard with hands-on experience responding to Ebola and H1N1. She is the real deal. And after her confirmation hearing, she pleaded to lead with radical transparency and unwavering scientific integrity. So good. That's exactly what America desperately needs right now. But here's the complication. Dr. Schwarz has also voiced support for Secretary RFK Jr. in Making America Healthy Again agenda. And senators pressed her again and again on that one question that will define her tenure. So what happens when your science conflicts with your boss's politics?
Well, that's because we've already seen this movie. Her predecessor, Dr. Susan Monterez, lasted close to a month. She was sworn in July 31st, and she was fired August 27th of the following year. So she was pushed out, she testified, after refusing to follow Secretary Kennedy's vaccine recommendations, which she said were not grounded in science. And the CDC has gone most of this administration without permanent leadership while losing roughly a third of its workforce to layoffs and resignations. So this is why Dr. Schwartz's historic appointment really deserves recognition, but it does not deserve a free pass. Being the first Black woman in that chair is historic. We give that. What she does while sitting in that chair will decide whether it's consequential. So the vote was largely along party lines, with only Senator Tim Kaine crossing over. And as physicians, we should want her to succeed not because she's a Democrat, she isn't, right? Not because she's a Republican, and that should be irrelevant. Right. We should all want her to succeed because pathogens do not have political parties. But Dr. Schwarz does not get a honeymoon.
Not at all, because the infectious disease picture is already out of control in the United States. So first, let's talk about measles. The CDC added 53 new cases this week, bringing the 2026 U.S. total to 2,371 as of July 30th. That already passes the 2,289 reported cases in 2025. And again, this is the highest annual count since 1991. We are talking about a disease that was declared, as we've said over and over again, from continuous U.S. transmission more than 25 years ago. But here we are. And so, Dr. Brown, what do we do to prevent that?
Vaccine, right? 2 doses of MMR, which is about 97% effective, right? We solved this. The United States had more than 25 years of this elimination of measles transmission, right? MMR provides protection against a virus so contagious that the CDC says up to 9 out of every 10 susceptible people exposed to measles will become infected. So the new director has to talk about vaccines almost immediately, not eventually, but right now.
Yeah, because we also have to deal with the largest cyclosporus outbreak, right, in America. So the previous record was 1,500, but nationally, the CDC counts about 23,000 cyclosporic cases since May 1st. 10,468 lab confirmed, and then 12,255 are still under investigation in what? 47 states. And that includes 2 deaths that happened in Michigan. So we're also not going to mention today that there's a salmonella outbreak being investigated with, multiple states involved, approximately 345 people across 27 states with 36 hospitalized, and a separate outbreak that was dealing with eggs that sickened almost 100 people across 17 states. And Dr. Brown, I'm recovering from COVID last week. Did we talk about COVID? No, because the CDC is no longer surveillancing the COVID outbreaks. So that's yet its own modeling shows infections for COVID in about 41 states as of late July. So we didn't talk about flu, Dr. Brown, or whooping cough or TB. So what do you think?
I think no one has been dealing with these the way they need to be dealt with, and any of them is a concern. Together, we should all be paying very close attention because, this week, pressed on CNN, RFK Jr. finally told parents to vaccinate their children against measles. Now, this is after years and years and years of casting doubt on the vaccine. And he's late. And, him being late doesn't mean we stop preparing, because preparing is literally why the CDC exists. But the issue is, let's just go back to Dr. Fauci. Because whether you admire him or you can't stand him is beside the point. The science is the science, right? And he can become the face of the pandemic and to millions a healthcare hero, and then become the target of this political witch hunt. And so now the Senate committee wants the Justice Department to prosecute Fauci for exercising a constitutional right his attorneys believed he needed. That's somewhere between these two events. America has to ask a bigger question, don't you think, Dr. Sloan? What kind of environment are we building for the people we're counting on in science and public health to protect us?
It's a very dangerous, slippery slope, Dr. Brown, because this same week that the Senate confirmed the CDC director, Dr. Erica Schwarz, a physician, a public health leader, the first Black woman to lead the CDC, we understand the significance. We understand the burden, because women, especially Black women in leadership, often learn that making history doesn't buy you more room to fail, but in fact, it can mean less room, right? So imagine measles all of a sudden now keeps climbing over the next couple of years during her tenure. Vaccines confidence keeps falling, as it looks like it will because of RFK Jr. Another foodborne outbreak explodes. Ebola, actually what lands on the shores of America across the ocean. And then, God forbid, another global pandemic hits. And imagine the scientific answers Dr. Schwarz has to give, the answers to the Trump administration, not what they want to hear. But because we just watched what happened to Dr. Fauci, it really scares the hell of us. So my warning today isn't for Dr. Schwarz. It's actually for all of us that are in the medical profession.
So, if America turns every public health crisis into a political loyalty test, even the best scientists stop volunteering to take it. And if we'll spend years, remember, the COVID-19 pandemic was 2020, we are in 2026. If we'll spend years pursuing one of the most experienced infectious disease physicians this country has ever produced, because we're still angry about the last pandemic, then we had better watch very closely how this country treats the first Black woman to lead the CDC when the next crisis hits and the science turns inconvenient. Dr. Schwarz said she'd lead with unwavering scientific integrity, that she'd never betray the science. America and Americans should hold her to that promise, but Washington must also allow her to keep it.
Right. So follow the science, you guys. Demand accountability. And for God's sake, let the scientists do their damn jobs. We're AYA, contributors to MeidasTouch Network, and proud members of the Meidas Mighty. Please follow, subscribe, like, and share for more updates. Have a great week.
Bye, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.